Class we are just going to have a continuation of last class, that is the electric shock. So in last class we just had a discussion of the basic thing, what is shock, what is the root cause of the shock. Now in this class we are just going to have a discussion, that is two different types of shock, that is the macro shock and the micro shock. Okay, so the macro shock, which is nothing but it is a large amount of current. When it passing into the body, it produces some sort of disorder, disturbance or a consequence. So the macro shock, that is a macro is nothing but is a large amount of current. The shock, as I said before, it is the cessation or unintentional flow of current passing into the body. Okay, so these current is usually follows a current path, that is from one external point to another, that is either from hand to foot or foot to, or left hand to right hand, or left foot to right foot, or hand to foot. So through the extremities, that is from the external point, it will travel into inside your body. So the threshold of the danger for this particular macro shock will be in the range of milliamperes. That is, if you're having the range, that is 1 milliamperes, that is a perception threshold where you can't feel any harmful. Okay, so that is the threshold point, and 5 milliamperes is the maximum harmless current. So till this, if you are passing the current, in the sense you don't have any side effects. If you are passing after 5 milliamperes, that is beyond milliamperes, then we will have some sort of side effects. For example, if you are passing 10 to 20 milliamperes, you can feel painful. And that is, you can feel start to feel the pain, and uncontrolled muscular contraction will be happen. And if you are exceeding the current, that is 50 to 100 milliamperes, obviously the person will have the fibrillation condition, that is a ventricular fibrillation. If the condition is not noticed immediately, the person will go die. So these are the threshold of the danger as far as a macro shock. And what is the source for this macro shock? In the sense, as I said before, especially the faulty electrical equipment, and also the exposed wires or ungrounded medical device if you are using, in the sense there are the chance for the person to get a macro shock, because you know that the macro shock is the current flow or the current passes through the body from the from external point, that is hand to foot. So these are the source. We can see commonly in a general public or the patients which was not connected to the internal medical devices. It means that you can see this particular shock is highly prevalent compared to the other type, that is the micro shock, because these shock is happening because of the external device, not the internal device. So mostly 90% of people coming to the hospitals, that is a patient coming to the hospitals, are going to use the external device. So that external device, if it is not doing calibration or doing it is not maintained properly, in the sense that external device will give you macro shock. So that's going to be the shows the common place where the patient will get the shock. Okay, so next we will see the micro shock. The micro shock is exactly opposite to the macro shock, because the same the micro, in the sense the word is nothing but it's a the very small current. Okay, so here the shock is being produced by passing very minimal small current, that is lesser than macro shock. So when this current is usually directly affect to the heart, when such device like catheter or internal electrodes is being used, which makes direct contact to the heart. So macro shock is the small electrical current that passes directly into the heart, usually through the invasive catheters or the electrodes. So the current path for this macro shock is totally different, because here it follows directly from the internal electrodes to the heart. Okay, so the here the source for this shock is like all internal medical device, because these internal medical device, we will have a direct contact with the internal targeted organs, whether it is a heart or some other things, we will have a direct contact. So if there is any leakage or any short circuit over it, it directly affect. There is an it is not the case like macro shock, it will travel all the way from outside to inside, but in the micro shock it will travel directly to the targeted area, that is the heart. So that is a very important, and that is the difference between macro shock and micro shock. So the because of this threshold of the danger, if you see in case of macroshock, is as little as 10 to 100 mu ampere is good enough to produce a ventricular fibrillation. That is a very dangerous one. Okay, so if you see the macro shock, where you can see only the milliamperes, it is milliamperes range is producing the shock. But in case of macro shock here, or even the microamperes, very less, 10 to 100 microamperes is good enough to give ventricular fibrillation. So it is very dangerous compared to the macro shock. Okay, so the source, as I said before, the fault currents from the device connected to the intracardiac catheters or the pacemaker leads. So these are the like main source, or the main thing through which the shock is being traveled, or shock is being delivered to the patient. So where you can see these sort of microshock is especially in the department called ICU or CCU, because where the patient is being connected with the internal medical devices. So that medical devices, if we're not doing properly calibration or something, obviously the medical devices will give you shock directly to the heart. So these are the, and this is that's all about the macro shock. So in the next slide I have brought the comparison between macro shock and micro shock in different features. So if you see the path of current for macro shock and micro shock, the path of current for macro shock is external body surface, whereas the micro shock directly to the heart, and dangerous current is less than, that is 50 milliamperes, whereas you can see in microshock that is 10 to 100 milliamperes. And the risk to the people compared to both are risk, the macroshock and microscope are both are risk, again is based on the amount of range, current range is being exposed to the people. If it is high range in the means, macroshock is very dangerous. If it is even the low current, okay, even the low minimal current, if it is passing in case of in case of microampere, that will be very dangerous as far as microshock concerned.